So exercise controls weight gain. Excess weight gain, and I usually tell my patients, look, if you're gaining over 35 pounds, if we look like we're going to hit over 35 pounds, I'm going to start yelling at you. I don't yell at you, but I am going to kind of say, hey, we need to be more conscientious, because excess weight gain has consequences. Increased risk of cesarean section, increased risk of developing gestational diabetes. While baby size is largely determined by genetics, meaning the blueprint for the baby, we can in fact eat so much that we influence the size of that baby. None of us wants to have a 12-pounder, so there are real consequences to gaining too much weight in pregnancy. Exercise releases endorphins. The orphins, that rhymes with morphine. These are our feel-good, our own feel-good chemical substances and hormones. That's the brain physiology of exercise. And you don't have to work out like Arnold Schwarzenegger to release endorphins. It's really more about consistency than going and benching 200 pounds or something. If you are you have been exercising and you've built up endurance and some strength, exercise shortens labor, delivery, and recovery time, whether you deliver by C-section or vaginally. Decreases the risk of C-section, we talked about that. Promotes better sleep. I mean, if you exercise, at some point you're tired. You sleep better. So you say, okay, great, I'm motivated, I'm ready to, woo, sign me up. The first thing I want to say is signing up with an expert like Gay for classes that are specifically designed for pregnant women, or following a program that's specifically designed for pregnant women, is ideal. If you don't live here in Tyler and you can't come to those, is it still Fit for Two?
It is.
Okay. You can't do Fit for Two. There are, nowadays, obviously, DVDs and videotapes and other things that you can do in the home that are designed for pregnant ladies. But definitely, trained experts understand all the physiology and all the changes and the things that we need to watch out for. Regular exercise is defined as at least every other day for 30 minutes, especially in the summer, which is now, indoors for pregnant women. And we'll talk about why, because a lot of the cardiovascular changes make it really hard for us to be outdoors when we're pregnant. And especially in the water. Water is wonderful, wonderful, wonderful for pregnant women, because it bears the weight of the pregnancy and it relieves the weight from those joints. So the nitty-gritty. So what I tell my patients is, okay, you should keep your heart rate in the 140s or less. And by the way, the 140s are going to be really easy to hit. If I have someone who is already exercising, already involved in a program, already in shape, we're going to use some different parameters. So this is, talking about kind of, a person who maybe has done a little bit, but is more or less, not super active routinely. We need to avoid activities where you can sustain a hard blow or fall. And I really don't understand why women seem to think that during these 9 months is the one time that I need to try rollerblading or skateboarding or horseback riding or four-wheeling or wakeboarding. You don't do that. Just don't do that. It's just like, don't ride the roller coaster. You don't have to do that in 9 months, in these 9 months. Low impact is great because it spares your joints. We're going to talk about that in a little bit. Yoga, Pilates, aerobics, again, water exercise, walking, all wonderful forms of exercise. It doesn't need to be really complicated. You don't have to wear spandex and drive to some huge facility. You can step out your door and walk, and if you are consistent about it, that's going to work. Weights are great. You can do weights while you're pregnant. By and large, we need to be mindful of the fact that the joints are loose, and I typically tell ladies, if you're already doing weights, back off by 25 or 50% on the weight and see how your joints do. If you feel arthritic, you need to back off even more. All of this is, you know, by and large, common sense. So I tell you, yes, the golden rule, if you feel physically comfortable doing this activity, you know, well, how long can I jog? If you feel physically comfortable doing this activity, you're okay. If it hurts, stop.